Hi, my name is Dr. Anthony Avery. I'm a sports medicine doctor at OrthoVirginia. I work out of the Tyson's office and the Arlington office. I'm here today to talk to you about patella dislocations. So the patella is the kneecap, and unfortunately, it's a very common injury to have a kneecap dislocate, especially in the younger population, in the teenagers and the young adults. It usually occurs from a twisting injury. When your knee twists with the leg extended, that's the most vulnerable point for the kneecap, and it can sometimes just very simply dislocate and pop out to the side. It's a very traumatic injury when it occurs. It's very scary, it's very painful, but it's also a very common injury, and it's one that there's a quick remedy to pop the kneecap back that you can do that can make you a lot more comfortable while you seek treatment. As we all know, going to the emergency room is probably a good thing to do for this injury, but you could sit there in the waiting room for a long time, and it could take potentially hours until somebody pops it back in. So just a little instruction to teach you how to pop it back in if that happens. So if it happens and there's a twisting injury and the kneecap's off to the side, if you look at the knee, you're oftentimes going to see somebody with a flexed knee, and the kneecap will be very deformed off to the side. So the first thing that I'd do is just gently touch around and make sure it's just the kneecap. If it's something other than this, of course, I wouldn't touch it. Call 911, go to the emergency room. But if it does feel like it's just around the kneecap, just an isolated kneecap that's dislocated, oftentimes popping it back in can be relatively easy. So you want to take deep breaths, get the patient, get the athlete to calm down, and then slowly extend the knee. As they extend the knee, sometimes as you get to a more extended position, the kneecap will just pop back in spontaneously. Other times, as it gets close, as it gets fully extended, sometimes you have to just give it a little help, a little poke. And sometimes just a little force can help pop the kneecap back over. So showing with this model, the kneecap is dislocated. Right now it's off to the side. As you straighten the kneecap, sometimes it just pops right back. This is a model which makes it look a little easier, but sometimes it's just as easy as straightening the knee. So if you need a little help, push it over, and then once it's back, there's still going to be pain, there's still going to be a lot of fear, but at least the pain should drop off significantly, and then you have plenty of time to seek formal treatment, either at OrthoVirginia or at a local emergency room. Thank you.